Uh, Good evening, everybody. If you could be so kind, if it's possible, turn on your camera. Okay. So that way we kind of know if you're listening, if you're in class, that'd be great. You could point the camera anywhere you want. I don't really care. Love to see all your face if possible. Okay. Um, that's just it makes it easier for me to teach virtually anyway. Okay. It's not the same thing as teaching to a blank screen. You don't have to have your camera on if you choose not to, but if you choose to, that'd be great. So we kind of know who we're talking to. Okay. So during the 1 hour seminar or webinar, whatever you want to call it, I would be typing a lot of notes in there. Lots of information will be given in the chat box, so feel free to look at it. First things first, my name is Dr. Brian Liao, okay? And that is going to be my email. I'm typing in right now. It's blao@hotmail.com. So if for any reason you guys have questions, feel free to type it in the chat box. If you don't feel like you want to talk, I'm very comfortable with it. I have got the chat already set up next to my screen, so I can visualize what you guys are typing in there. If for any reason you did not get your answers questions, feel free to drop email to me. Okay. I've got this sickness where I have to answer your email within 24 hours. So for any reasons, if you have questions about the course, anything about orthodontics that you feel like you have to ask and there's nobody to ask, I could be that person for you. If you have been doing orthodontics for over a period of time, you've got some experience, you run into situations in your own cases, you feel like you want somebody to talk to, I could be that person for you also. Okay. I usually answer about anywhere between 40 to 50 emails a day. And I will always try to answer your questions within 24 hours. So that's my promise to you after this seminar. Okay. A little background history about myself. I graduated from NYU. Well, I guess this would be a better way to just kind of go through this with you guys. Okay, so let me share my screen with you guys. Okay, so I am a tenure instructor for POS. I've been teaching for progressive orthodontics for a long time. Okay, longer than I could remember. But a little background history on myself. I got my undergraduate degree at UC Irvine, and I graduated from NYU Dental School in 1999. After that, I did a year residency. 2 years after I graduated, 3 years after I graduated from dental school, I took POS. So as a general dentist, one of my things when I graduated from dental school was I actually really wanted to become a orthodontist. So as soon as I graduated from NYU, I actually applied for the residency program at NYU, and I was accepted. But then I made one mistake. I got married. I got married very early. So, you know, after you get married, you have to support a family. So I didn't go through the residency program at NYU, which is actually a blessing. 20 years now that I've been practicing, because now I can do an array of things, including orthodontics, include implant dentistry, include cosmetic, everything. Okay, so after I graduated from NYU, I started my own practice in this little place called Gilbert, Arizona. most of you probably, well, probably most of you heard of it, because in the year 2000, Gilbert, Arizona was listed as one of the fastest growing city in the entire country. So I was at Arizona. So I was at Arizona for about 10 plus years. And I started doing orthodontics right after I graduated. And I became really, really busy. And everybody knows what happens in the 2008, during where we had the housing market crisis, where everything kind of just tanked. A lot of my friends around that time had to shut down their office. Some of them actually went bankrupt. They just couldn't do it. But for some reason, well, not for some reason, from 2008 to 2010, my practice was growing about 20% annually. And a lot of that was due to the fact that I knew how to do orthodontics. Yeah, so that's one of the things I kind of really attributed to the success I've had over the years. Because, let's be honest about things. In a down economy, which we're not in right now because we got money flying everywhere, but in 2008, when the economy was bad, the only kind of money that was being spent was on kids. And I got really, really busy doing orthodontics. In fact, between 2008 to 2010, I would say about 40% of my production was solely based on orthodontics. And I'm a general dentist, just like most of you are. So I have a very clear perspective on what general dentist GP ortho is all about. And that's what I'm here to talk to you guys about. Because after I gone through my training with orthodontics, I got into implant dentistry. So when I was in Arizona for over 10 years, it was a one-man practice, and I was running 2 practices myself. And I got so busy, I developed carpal tunnel syndrome. All of you know what that is. And I took a few years off, became a POS instructor, and I was lecturing around the world. And I actually moved my family back to Taiwan, which is that little island off of China. So I moved back to Taiwan for about 5 years, and I started my own full mouth reconstruction clinic where I was doing a lot of ortho and implants. I have a partner who is a periodontist from Columbia University. So the 2 of us was just cranking out. 4 years ago, we moved back to the States, and this time I relocated back in the Bellevue area in the Seattle, Washington area. Most of you probably know where that is. And I just started my own clinic, and this time around I'm doing all digital. So I've got a 3D printer, I've got a CBCT machine, I've got an intraoral scanner. So everything is now digital in my office, which is kind of exciting for me. Because if you do the calculation, if I graduated in 1999, this is 20 years of clinical dentistry I've been involved in. And I have to say, I truly enjoy doing dentistry. But if it wasn't for the fact that I was able to incorporate orthodontics into my daily practice, I don't know if I would be truly enjoying doing orthodontics for this long. Because when I graduated from dental school, all my friends were jumping into implant dentistry. And because implant was what's making money. And I call that immediate gratification. But if you think about it, for those of you who's been in practice long enough, you know you can't put implant just in anywhere, okay? In order to place implants, you got to have the right space, the right bone, and the right occlusion. Anyone in this room could put an implant. But to put the implant in the right position, in the right location, you really have to understand occlusion in orthodontics. And I'm a true believer of that. Okay, so let's go back to the slides. All right. Okay, so, and guys, again, for anybody that has questions, please just go ahead and type in your question in the chat box. I will be looking at the chat throughout. Okay, so graduated from NYU. Okay, did my residency program in New York. Got my Invisalign certification, which is pretty much what everybody did. Got my residency training through UCLA. I'm a fellow for the ICOI. Okay. And I've been a POS instructor ever since. Okay. This is Dr. McGann. He is the founder of POS. Okay. So a question that everybody usually asks is this: why? Yeah, and if you guys could mute yourself, that'd be great. All good. If you could just mute yourself, that'd be great. And if you guys can turn on your camera so I kind of know who I'm talking to, that'd be great. Okay. So a question everybody always asks is this: why orthodontics? Okay. Why not just let the orthodontist treat these things and so be it, right? So my philosophy is this. I mean, let's take a look at this case. Okay, right off the bat, we're going to take a look at a case. If you're looking at this case right now, without looking into too much detail, well, that's good. The class is involved. If you guys were looking at this, how would you classify this? Dental classification, class 1, 2, or 3. Just typing your answer in the chat box. So I'll take a look at it real quick. Okay, so question number 1: if you had to categorize or diagnose this patient just by looking at this right now, how would you classify this? Is this class 1, 2, or 3 case? Keep going. I'm looking at the chat. I'm looking at the chat. Most of you are saying class 3. Very good. Yeah, and if you look at this right now, she's got missing teeth, right? I mean, right off the bat, that looks like that's a first bicuspid. So I'm looking at a missing lateral and a cuspid right here, right? That's, everybody can see that. Okay, she looks like she has missing teeth right there, missing teeth right here.
Yeah, I figured put it on until you're ready.
And so this is the panoramic x-ray we're looking at. So what do you think the patient wants when she comes into the office looking like this? I mean, if you ask me, yes, her chief complaint is she doesn't like the way she looks. But what is she really asking you? Is she asking you for implants? I don't know if she's just asking you for implants. In my opinion, I think she wants you to fix everything for her. Okay? Better smile? Yeah, I would agree. I mean, what else is the problem that you see? I see anterior crossbite. I see missing teeth. I see a slightly protrusive profile, right? I see the midline that's not centered, right? And if I ask you to treat this case,
I don't know.
Yeah, you don't know. That would be the right answer. That was perfect. I know you weren't meaning to say something, but that was perfect. Okay. But if I were to ask you to treatment plan this case and ask you, and the patient is going to ask you, hey, doctor, I know I need implants, but can you tell me how many implants I would need? So I'm looking at this case as patient is missing in 2 upper molars right here. Okay. A lateral and the bicuspid is missing. That's gone. That's a goner for sure. Okay. And that's an 8. All right. So if the patient is asking you, hey, doctor, I in order to improve my smile, I know I'm going to need implants. Can you tell me how many implants I would need? Okay. So I guess my second question for all of you is this: if you're just looking at this record right now, can you give me an idea how many implants this patient may need? Anyone, just put your answers in there. There's no right or wrong answers in there. And this is the way she looks. Okay, 2 to 3. Anybody else? Anybody else want to guess on this? I mean, we've got missing teeth on the upper right quad, 2 missing teeth right here. That's a bombed out tooth. I don't know what we're going to do with that. Okay. All right. So everybody's giving me some answers. That's great. Let me ask you guys this. If you see this case, what should be the first thing that we do? Yes, she's going to need implants. She absolutely needs implants. But tell me, what is the first thing you would have had to do in this case? Yes, she's going to get some teeth extracted. Of course, she's going to need some restorative. We're all general dentists. We can do all these things. But after we clean up, let's say, for example, that tooth probably is a goner. Maybe I can keep this tooth right here. That tooth is a goner. Okay. But after all said and done, what's the next step that we have to do? Create space. That's perfect. So what does that mean? If you're saying that we have to expand, we have to create spaces, you have to do ortho first. Right, everybody? So this is why I've always said anyone can do implants. Anyone. But in order for you to do nice implants, you have to find a way to have the proper spacing, right? Okay. So another question that patient is going to ask you, very clear. What are you going to do with this space? What are you going to do with that tooth? Are you going to extract that 8? Are you going to use that 8 at all? That third molar. Okay. That's vote. How many of you think we can use that tooth, or we have to extract that lower third? Anyone? Just vote. Do we have to? Can we extract, or can we use it? Okay. All right. Use. Okay. Anybody? Use for ortho and incur. Does anybody else want to chime in on it? Can we use that tooth? I mean, that's got a pretty severe mesial impaction. I mean, mesial tilting, if you ask me. Can we possibly use that tooth? Would it be easier to extract that tooth and place 2 implants? Right? I mean, these are all the things that you're going to have to find a way to answer. Well, how does that look to you? I think that looks pretty good, right? Okay. We were able to upright that molar, place an implant instead of placing 2 implants, right? Okay. So what do you think of that? Does that look pretty good to you guys? I think that looks pretty good, right? So if I can upright this, I would save the patient some money for prosthetics, right? And we were able to put an implant in there and solve the problem. Why? Because if I have 2 molars, I usually like to end with 2 molar occlusions. Okay. All right. So this is what she looks like. Maybe 2 years of treatment. Okay. This is at the end, 2 years of treatment. Okay. All right. All right. Continue. That's what she looks like 2 years after treatment. Okay. And we ended up with 1, 2, 3, 4, 5 implants, with the understanding that this tooth eventually will have to be extracted and place an implant down the future. Okay. So thank you very much for all the nice comments, everybody. Okay. So if you ask me, I think we did a great job for her. And yes, we did tell her to get a new haircut, and she did. So that improved dramatically. Okay. Profile looks better, right? So if the profile looks better, what is this telling you guys? Most likely, we had to extract some other teeth, right? Okay, because you see a profile improvement from a little bit of convex profile to a much straighter profile. So even though this case had all these missing teeth, we still ended up extracting some teeth on the lower arch to improve her profile. Okay, this is before and after. And guys, I'll be honest with you, if I have to put a grade on this case, I probably give it a B+, and I'll tell you why. Because that's actually an implant crown. That's an implant crown, okay? But notice how the gingival level is not the same on this one versus that, okay? I probably would have suggested her to get maybe a little gingivectomy with a little bit of crown lengthening on that to make it both look better. This probably should have been diagnosed for a crown. I didn't do it at that time. Not a big deal. We can always talk to the patient about this afterwards. Okay. All right. And if you ask me, this case was fun. It was a lot of fun. 5 implants, and I'll tell you how much this case I ended up getting paid for. 5 implants. Each implant was about $4,000, and the ortho itself was about $7,000. Okay, so we're looking. So that case I got paid $27,000 for in 2 years' time. And to me, that's very satisfying to me, for myself, because we know the patient needs the implants. We know the patient needs restorative, but I gave her a treatment plan starting from month 1 going down and letting her know what needs to be done. Okay, so to me, that's what we can do as general dentist. Okay. It does take some time to learn orthodontics. Okay. But in my opinion, if you really want to be good at what you're doing in dentistry, you have to understand a certain amount of information about orthodontics. Okay. Any question about that case I just showed? That case had a lot more detail, which we're not going to go into. That's irrelevant. Any questions about that case? And I honestly thought that case came out quite well. It's not an A+, it's most likely a B+ case. Okay. All right. Guys, orthodontics is no longer just straightening out teeth. Okay. In my opinion, orthodontics is cosmetic dentistry. Let's take a look at this case. All right, everybody, what are the problems you see? Type in your answers. Anyone, let's go. I only have about an hour with you guys. Got me smile? Perfect. That is great, Dr. Park. Okay, was this your earlier case? How confident were you when I started it? Aniza, that's a great question. And that the first case you saw is a case I treated much later. How confident was I? I was not confident. I'll be honest with you, but I had very, very good instructors that POS provided. I myself was a student for POS. Yvetta has known me for 20+ years. Okay, she knew I was a student way back then. So I was not confident at all. But here's one thing that separated POS from everybody else. We have really good support. We had extremely good support, and I'm not just saying this because I'm being paid to do so. Yes, I'm being paid to do so, but I'm not just saying that, because I had instructors who would answer my question within 24 hours. I had questions after questions after questions, and I had instructors helping me on just about every single case along the way. My first case was a cuspid impaction where I learned to do it, okay, by just watching CD-ROMs. Okay, back then it was CD-ROM. It wasn't even USB drive or any file. Back then it was CD-ROM. So that's how long ago it was. So I had a ton of help, and I basically just told myself, you have to trust the system you're working with. You have to trust the guidance. You have to trust the instructors. So we have excellent instructors that was helping me. And now that I'm an instructor, I'm there to help doctors. Every day, I answer email after email after email. Okay. You know, case in point. Let me see if I can pull this off for you guys to see. Okay. Yeah. So you know, like this is everybody could see my email. Every day, I answer questions. Okay. For example, this is a doctor from Australia. She sends me her progress photo, and she's freaking out because the midline was off to the right, and it wasn't off to the right at the start. Okay. Well, why is the midline off to the right? Well, if you look at it, that's because the upper left quad still has a ton of space. So very quickly, I just gave her a quick answer. Don't panic. Okay. And that's my answer to her. Okay. And she was fine after that. Okay. Every day, I answer questions from doctors all over the world. Okay. And that's what we're here for. This is a doctor from California, I believe. Okay. And they have questions. I'm here to answer them. Okay. All right. Questions, everything's being answered. Okay. So if you're talking about confidence, you and I are never going to be confident on the things we do right away. Think back to the first molar endo that you ever did. Okay. How confident were you? You're probably not, right? But now if I ask you to find the MB2, it's not going to be that difficult, right? Because it's either an MB2 or it's a perforation. That's it, right? That's a joke, guys. That's a joke. That's a joke. That's a joke. Okay. So the reality is, you and I are, you're not going to be that confident at first, but if you're willing to put in the hours to study, and you're willing to ask questions, then you're going to be successful. Okay. In fact, I can share this little story with you. I don't know if Yvetta ever heard about this. You probably did. You know, I asked so many questions in
I will
class.
see.
You probably know. I asked so many questions in class. My instructor at that time, you know, actually got fed up. In front of the class, he actually told me to shut up. Did that stop me? Of course not. I just kept going and kept going and kept going and kept going. And everybody around me was like, oh my God, he told you to shut up. I'm like, I don't care. I'm here to learn. And that's kind of the attitude you got to have if you want to learn something that's different than what we've always known. And I went to NYU, which was one of the top dental school in the country. I think it is. I don't know if it still is now. At least when I was there, it was top. It was very good. You know, and one of the things when I was in ortho class, and I'm pretty sure all of you would attest to this. You know, when I was in ortho class, our instructor, the first thing he did was handed out his business card to all of us. And he's like, after you guys graduate, if you guys ever need to refer a patient, this is who you refer to. And, you know, that didn't sit well with me, because the entire semester, they kept telling us that you have to be really smart to do orthodontics. And that's not true, okay? I think you have to be really smart to do really good endo, because I hate endodontics. Okay, root canal is one thing I've always hated it. I could do root canals just as well as anybody else does, but I hated it. Okay, but that's me. You know, some of you in this class love root canals. That's great. More power to you. But that's just me. Okay, so let's go back to this case. All right, class 2, div 1 or div 2. Okay, proclination. Now, guys, the first thing I want you guys to look at is this line I'm drawing right here. From the tip of the nose to the chin button, right? This is called the E-plane, okay? You've heard of that in dental school. If you ask me, I personally feel her profile is slightly protrusive. And since you guys here, since this is only a 1 hour or an hour and a half seminar, I want to teach you guys something. Orthodontics diagnosis is all based on patient profile. Let me repeat. When you're diagnosing orthodontics, 90% of the time, you're going to be diagnosing based on profile. And 90% of the time, you're going to be diagnosing based on this thing called the E-plane right there. Okay? All right. So if the lips are in front of the E-plane, obviously that's a convex profile. And if the lips are behind it, that's a concave profile. If the lips are right on the E-plane, that's a straight profile. Well, if the patient comes in with a convex profile and they know they have a convex profile, chances are you and I are not going to be treating the case non-extraction, isn't it? Right? Okay, and if a patient comes in with a concave profile, chances are you and I are not going to extract that case anymore. Okay, so that's something you guys can take away from this hour or an hour and a half seminar. Okay, orthodontics diagnosis is completely based on profile. Okay, all right. Okay.
Case the music that I will be without a job and everything.
Okay, if you have a question, feel free to ask. Okay, let's continue. And I do agree, there is a fair amount of gingival display in this case. All right, so this is what you see right now. She does have crowding. Okay, all right, upper and lower. Okay, all right, question. Based on what you see right now, are you leaning towards extraction or non-extraction? Starting with the profiles, starting with the amount of crowding you see, just typing your answer, exo or non-exo. That's it. Just putting your answer in there, guys. There's no right or wrong answer, guys. This is just for me and just to communicate with you guys. Anyone? Do you feel this case should be treated extraction or non-extraction? Anybody? Extraction for spaces, extraction. Okay. Anybody else? Okay. All right. So my follow-up question is this now. If you extract in this case, what do you think would happen to the gingival display? Is it going to increase or is it going to decrease? If you extract this case, will the gingival display increase or decrease? Anybody? If you extract this case, yes. Yes, of course. When you extract, you would expect the gingival display to increase, right? Because she doesn't like her profile. She doesn't like the way she smiles. She doesn't like the gingival display. So if you extract, you have to retract all the anterior teeth back. As you retract all the anterior teeth back, you're going to have more gingival display. Okay, so in progressive orthodontics, we will teach you how to correct that. So that's fast forward and just take a look. And guys, in orthodontics, in POS, we will teach you how to do tracing of the frontal ceph and the lateral ceph. This is actually a requirement for a GP to do good ortho, in our opinion. And I truly believe that to be the truth. Okay, you would know, all of you would learn what all these numbers means. Okay, all right. So this is what she looks like 2 years later. Okay, that's the profile. Okay, that's her high smile, guys. All right, so this is the final. Okay, this is before and after. And to me, this is the money shot. Look at the profile change, guys. Look at the profile change. Look at this smile. This is a huge difference. This is a game changer. Okay, if you ask me. Not only did we straighten out her teeth, we gave her a better smile, and we also took away her gum. All right. Okay. And these are some of the things that all of you will learn how to do. This is not, guys, and I'm a general dentist just like all of you are. Okay. Now that case was a little bit more involved. That case was a 4 bicuspid extraction with a couple screws to lift the premaxilla, followed by a full mouth upper arch gingivectomy with a crown lengthening. Okay, and we will teach you how to do all of that. All right, we will teach you guys how to do all of that. Okay, well. Great, let's go back to the same question. How confident are you? I mean, are these your earlier cases or are these your later cases? Okay, well, let's take a look and see what some of the cases that students could do, okay? All right, so these are not my cases now, okay? This is a case that was treated from a doctor in Australia, okay? This was the starting record. I gave her a treatment plan and she treated it like this. Okay, this is a full-on anterior crossbite. Most of you would have probably thought this is a surgical case. This is not a surgical case. This is a simple lower bicuspid extraction. Okay, all right, so this is a simple lower bicuspid extraction. So for this case, all right, so I'm putting some notes in there. Case 1, this is an extraction of lower 4s only. Okay, so after you extract the lower 4s, okay, the molar now is full class 3. And the cuspid is class 1. Right, everybody? Okay, everybody see that? The cuspid is near class 1. The molar is full class 3. Okay, all right. So I gave her a treatment plan. She carried it out. And that's exactly how the case is treated. Now, if you ask me, then this is a doctor. This is a case that's treated by a doctor in Australia. I gave her the treatment plan. I helped her every step of the way, and she treated it. And you can see right here, she took out the lower 4s. Okay, all right, they're lower bicuspids. All right, and if you ask me, I think this case came out to be really, really well. Okay, all right, so kind of a little discussion about occlusion. All right, so everybody, let's take a look at this. Okay, so if you take out a lower bicuspid, okay, that means this is how the occlusion is going to finish as. Okay, with the cuspid class 1, molar with full class 3. Right, everybody? Okay, so that's what it looks like. Okay, any questions about that case? If you ask me, I think that case is very, 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 very successfully treated by the doctor. Okay, all right. Okay. Here's another case. Patient has excessive overjet. Okay, patient has excessive overjet. And what did she do? She took out upper 4s. Okay, All right, so case number 2. This is an extraction of upper 4s only. So by the same logic, now it's in reverse. Molar is now going to be full class 2, and the cuspid is going to finish class 1. And if you ask me, I think this case came out very well too. Look at the amount of the overjet that we had at the start and look at the finish. Okay, so these are cases treated by the doctors. This is not my case. This is not the instructor's case. These are cases treated by doctors who hasn't graduated. Okay, she's graduated since. This is another case. Well, guess what this patient did? He had a headgear. Okay, what does a headgear do? Well, the headgear distalized the upper arch and finished his case in class 1, right? Okay, so guys, if you ask me, can anybody do orthodontics? The answer is absolutely yes. Okay, it's whether or not you want to do it. Okay, and you know, from my personal experience, when I wanted to do orthodontics, I didn't want to just take those weekend courses where they teach you a little bit of stuff and tell you to start taking cases. In my opinion, and I hope you guys feel the same way. When I was looking for orthodontic courses to take, I wanted to find the most comprehensive courses out there to take. And every one of you has probably received hundreds, if not thousands, of flyers from orthodontic companies all over the country. I personally feel that in order to do ortho, you have to start understanding the basics. Once you understand about the basics, then you can move on to everything. And what is understanding the basics? Understanding the basics means understanding occlusion. Right? If I tell you to extract 2 upper 4s, in the back of your mind, you have to immediately think, okay, if I extract the upper bicuspid, my molar now needs to finish with class 2. And if I tell you to extract 2 lower bicuspids, in the back of your mind, you have to automatically think, okay, so that means my molar needs to finish class 3. Now, in both samples I just showed you, the cuspid ended up being class 1. Okay, so to me, this is what orthodontics is all about: training. The more basics training you have, the more solid your foundation is, the better it's going to be at. Okay. And in POS, we offer there, we have a ton of helps. Okay. For example, one of the things we offer is this thing called the case diagnosis. If you take on a case, you don't know how to deal with it, all you have to do is submit the case to an instructor for a fee, of course. We'll diagnose the case for you, we'll send you back the treatment plan, and we'll tell you step by step what to do. Okay. For example, before this seminar, before talking to you guys, I was working on this case. Okay. And this is our software. And let me just see if I can see. Okay. So this is our software. Our software is called SmileStream. Okay. This is the first page you will see. There's a lot of information, questions asked by doctors, and there's answers in there all the time. Okay. So let's just go take a look at this case that I'm working on right now. This is a case that was sent to me by a doctor in Australia. Okay. All right. Okay. Let me just go to this page real quick. And once you're a POS student, this software is free for you, for everybody. Okay, so you're free to use this software to your liking. Okay, so this is the patient. This is a 9-year-old patient with a concave profile. all of you looking at this profile are probably going to say non-extraction, right? None of you are going to say extract this case, because if you extract this case, the profile is going to be worse. Okay. She still has some primary teeth left in there. Okay, so I consider this to be a mixed dentition case. And yes, we do treat mixed dentition patients. Okay, so what I did for this patient, for this doctor, is I work up the cephalometric analysis for him. Okay, we did a model analysis, and we came up with this thing called the visual treatment objective, which is like a before and after. Okay. And so this is the before and after VTO that I came up with for this doctor. Okay. And after I came up with this, then I would have to give him a treatment plan. Okay. All right. Okay. And the treatment plans are going to be very detailed. It talks about what we want you to do every step of the way. Okay. So the support system is there for all of you. Okay. And it's not just a one and done thing. Once we send you a case back, if you have questions, we're always here to answer your questions. Okay. I made it a personal thing for myself where I would always answer the doctor's question within 24 hours, sometimes a lot less. Okay. And maybe I'm overkilling you now because I'm answering about 30 to 40, if not 50 emails a day, but the support are there. Pre-COVID
parents' anniversary. I heard it. The party's been.
Okay, so pre-COVID, we were doing lots and lots of live classes all over the world. Okay, in fact, I used to travel maybe 20 weekends out of the year. I think 1 year I traveled 35 weekends, and I think Yvette was pretty shocked too. You didn't realize that.
I'm still shocked about it.
Yeah, I didn't even know what happened. So 1 year I ended up traveling 35 out of 52 weekends just for lectures. Since COVID, the world has changed. We all know that. Okay. We are still doing some live classes. We are doing lots and lots of virtual classes. Okay. You know, that's just the way things are. Okay. If you take a look at this is me teaching a webinar on Zoom. And some of the things that doctors always question is, how can you do any kind of hands-on through virtually? Okay, well, we have this thing called the hover cam, and it allows us to kind of zoom in and show the details. So this is me teaching wire bending. Okay, and you can see this is pretty clear. All right, I've had a lot of doctors over the last 2 years who's graduated without me ever meeting them in person. So this is something we offer now. Okay, so we do offer both virtual class, we do offer both live classes. It's whatever you feel comfortable with. Okay, if you feel like you want to just stay home for this for whatever reason to learn, that's fine too. If you feel like you're okay with, you like to meet in a group setting, that's also okay too, because we will offer both that to you guys. Okay. All right. Any questions about anything that we've talked about so far? Any questions? Any questions? Anyone?
Dr. Liao, can
Yep.
I
Please.
just add something?
Please.
I just wanted to, now during the COVID and the self-study with the mentor became really popular. Of course, we have still a lot of doctors who want to go to the live setting, but I just wanted to bring it up that you only pay once. So even if you study online and then there are some classes that you want to attend in person, just let us know, and the policy goes worldwide. So we have a free lifetime retake policy. So anyone who wants to start, you can start at any time. You can belong to a class, whether it's virtual or live, but again, you can retake free of charge for life.
Yeah, so personal experience, I took POS 3 times in a row. So that's 6 years of my life. Okay, and I only pay once. Okay, because I love the fact we do free lifetime retake. It's you never understand everything the first time around. The first time I took it, I maybe understand 40% of it. Second time I took it, 60%. Third time, maybe 80%. Okay. And a lot of it, the rest of it is just through experience, through mistakes, and you just keep correcting it. No one ever gets their first case perfect. It's not going to happen. Okay. But we all learn from our mistakes and we just keep going, just like everything else we do in dentistry, isn't it? Right? Okay, the first time you do your molar endo, it's probably not going to be perfect. The next time you do it, you realize the mistake you made in the previous case and you just keep improving on it. Does the course hit phase 1 treatment? Oh yeah, actually, Dr. Lee. There's a question that's asked in the chat, and feel free to type in all your questions in the general chat. Okay, so we're all friends here, we're all colleagues here. Dr. Lee asked this question, does the course hit phase 1 treatment very much? Yes, we do. In fact, we spent about 2 seminars worth of time on phase 1 and on phase 1 treatment. Okay, we talk about headgears, we talk about when to extract, when not to extract. We talk about growth extensively. We talk about utility arch. So all those are, and we talk about functional appliances also. Okay, so we are very comprehensive. I have to be honest, in the last 20 years, I've only referred a handful of patients, and usually the ones I referred are the ones who are adamant about seeing a specialist. And I'm completely okay with that. If the patient goes, I have to see a specialist, I usually refer them to the specialist I hate the most because I want them to suffer. Okay? All right, that's a joke, guys. That's a joke. Okay? But I've taken on class 1, class 2, class 3, non-extraction, extraction, and I've done orthodontic surgery cases also. I've put in bone screws, bone tabs. Okay, everybody knows what a tab is, right? Okay, I've done all of that. Okay, you know, I've gone through a wide range of cases where I just feel like, you know, it's something that we all can do. And guys, I'm here to help. Okay, and true story right here. I'll show you guys real quick. Okay. All right. So this is not my case. This is a case that's treated in Singapore. Okay. The doctor needed to put 2 screws in there. Okay? So guess what? One day when I traveled to Singapore to lecture, she asked me to go to her office. Okay. So I went in there. Okay. And well, I guess it's being recorded, but I don't really care. Okay, so I went into her office in Singapore and I placed the screws for her, even though I'm not allowed to work in Singapore. Okay, all right. So I went into her office, I put the screws in for her, and she's the one that finished the case. Okay, I've gone to Houston, go to the doctor's office. I'm not licensed in Texas, so I'm sitting there, I'm the assistant, and I'm guiding the doctor putting screws in there. Okay, so that's something we do. All right. Okay, as a beginner, is it better to wait for both molars to fully erupt to start a case? Dr. Khan, if you're talking about mixed dentitions, I would say once you have the first molars erupted, you can treat. Okay, if you're talking about a teenagers, let's say, for example, 12, 13-year-old kids that needs treatment, the 7s may not be there. you can still treat the case, okay? Because sometimes if you wait, the case may go south very quickly. All right, so to me, if you see problems in orthodontic, if you see problems in the kid's mouth, you would start treatment earlier, okay? Do we also teach clear aligner series? Yes, we do, okay? That's a separate course from the basic course. The basic wire orthodontic course is 12 seminars with 4 seminars each, so that's a total of 48 days. And we have a separate course for aligners, and I believe that's 12 days, okay?
It's 12 days, and as a
It's
POS
12 days.
member, there is
Right.
You can take both, and there are discounts, or you can take
Yes. Yes.
just
Is
either
the
or.
is the basic course a prerequisite? No, not for
No.
the aligner. Okay. But Anizan, I have to be honest with you. In order for you to understand aligners really well, you really should understand wire ortho and aligners, because there are things in the aligners that's different than wire ortho, but ultimately tooth movement is tooth movements. And you and I already know, and we've seen this from a lot of doctors, from a lot of cases treated with Invisalign. Some of the cases treated with aligners are not perfect, right? For example, a severely rotated canine is going to be very, very hard to correct with aligners. And you could sit there and do refinement after refinement and after refinement. But wouldn't it be so much faster after the last set of aligners, you put a few brackets in there, correct the rotations on the canines, and call it a day? So a lot of these cases require both a combination of wire ortho and aligners. So in my opinion, in order to do really good ortho in a general practice setting, you really should understand both wire ortho and aligners. And we're all practicing in a very litigious society. I like to protect myself. I want to protect all my students. So if you're going to do aligners, you really should understand how to do wire ortho also. So yes, you can go to aligner series right away, but I highly recommend you take both in conjunction. Okay, if possible. I realize it's going to be a big investment. We all did. What are your thoughts on airway? Yes, we all focus on airway very much. One of the things we will always talk to you about is not violating the tongue space, right, Dr. Lee? Because as you extract, you retract, you may violate the tongue space. So airway is something we do focus a ton on. Does POS teach TADS and TADS expansion? Of course. Okay. All right. I will be happy to teach you guys how to use TADS. No problem with that. Okay. I just show you that case where, this is a doctor in Singapore. I went in there and I placed a TADS for her. It's very simple surgery like that. We just put the screws in there and that's it. Okay. That's it. That's it. Very simple. Okay. And also non-extraction point of view, there are more. Yeah. Orthodontics has actually kind of come full circle. In the old days, most of the patients were getting treated with 4 bicuspid extractions. So if you look at some of your patients that are in their 60s or even 70s, and most of them that had treatment have 4 bicuspid extractions, okay? Because back then, the belief was everybody has to fit on what's called the APO line, okay? So there was a certain requirement on where the incisors are supposed to finish as. And then we've gone through a little bit of change as far as philosophical change in orthodontics, where a lot of guys were treating cases non-extraction with a lot of expansion. The most famous, of course, is the Damon system out there, okay? Our philosophy is this: if we can treat the case non-extraction, we will always try to treat the case non-extraction, but not at the risk of over expansion. Because if you overexpand, there are chances that you may end up with gingival recession. So gingival recession means what? Bone loss, right? So our philosophy, or my philosophy, has always been this, okay? Function over aesthetics. If I cannot keep the teeth within the basal bone, then I would be okay with extraction. Okay, thin biotype is another reason. If you see a patient with very thin lower anterior tissue, and you know that if you treat the case non-extraction, you're expecting the incisors to advance a lot. And if the incisors advance, now you're going to be talking about gingival tissue loss. And if that's the case, it's probably not a great idea to treat the case non-extraction, isn't it? Right? So all these are things we will talk about. We will talk about when to extract, when not to extract, and all those things in the course. Okay. So guys, you know, most of you have never met me. All of you have not met me. You know, coming from, and I was in the same position as you guys are 20 years ago, except we didn't have these webinars. You know, 20 years ago, I call up POS as a student, and I believe I actually talked to Iveta, and I was referred,
I think so. Yes.
yeah, and I was referred to one of our instructors, Dr. Joe Viviano, and the only question I asked was, what kind of cases am I going to be able to treat? Okay, and when Dr. Viviano said to me, you can treat anything you want, that sold me. That's exactly what I was looking for. I wanted to have that ability to treat all kinds of ortho cases in my career. Okay, but everybody's different. Every one of us is different in this class. And you're all very successful in your own way. I'm not saying that you should not continue what you do. What I'm saying to you is, if you add orthodontics, it's going to change some of the things you do in your office, and not to mention, it's actually very lucrative. Have you ever had to refer mid-treatment? The answer is absolutely no. Absolutely no. And we will not let you do that either, because when you start a case, I would highly suggest you get one of the instructors to work with. Okay. And if an instructor sends you, let's say, for example, you send a case record to an instructor and the instructor goes, this case is too hard for you, don't do it, then we would suggest you refer the case right away. Okay. Once you have more experience, then maybe you can take on that type of case. We will never let you start a treatment, let you hang out there to dry, and then say to you, please refer, because that's an open door for legal action. And we will never put you in that situation, Dr. Aniza. And we will never, ever put you in that situation. I have never had to tell anyone to refer in the middle of the treatment. Okay. And I've probably diagnosed over 10,000 cases in the last 10 plus years. Not one doctor has had to refer midway through the treatment. So that would never happen. Okay, but that's a very good question. Okay. Any other questions, ladies and gentlemen? Any other questions? Okay. Okay, you're welcome. Any other questions? Okay. Yeah. Iveta, are we still doing like the first seminars for a discount thing like I did back then?
Yes.
Okay. What I would like all of you to consider is, if you're not ready, and this is true story for me, okay? If you're not ready to like jump in completely to POS, which I wasn't right away. Okay, so I took the bait. I joined seminar 1 at a discount. Okay, so when I came to seminar 1, in half a morning, I already knew this is what I wanted it. Okay, until I saw the bill, it was going to be like $18,000. I kind of just sat there and I look at it. I'm like, what am I going to do? I just graduated from dental school. Well, guess what I did? I just put everything on a credit card. Okay, I just put everything on a credit card because I didn't have any money back then. I just graduated from dental school. The first seminar may be free. That's even better. Okay, so wow, we're really open. We're really rolling out the red carpets for you guys. And you know, so right away after seminar 1, I was $18,000 in debt in credit card. But I knew this is what I wanted to do because there's no other program that offers anything like this. You know, and then seminar 3 comes around. We were told that we have to purchase quite a bit of supply or inventories to start our office. And guess what I did? Swipe it on the credit card, and I just started it. Okay, so ever since that time, 20 years ago, I just told myself, this is something I wanted to do. And I study. I still have notes that I took 20 years ago on the same computer right here. I truly believe this is something, if you're interested in orthodontics, I truly believe this is something you all can do. The only question is, you got to ask yourself, is this, how much, how hard do you, how much do you wanted it? You know, and I this is something I usually tell everybody. Okay, you know, confidence is through experience, and experience is through repetition. And I tell my son this all the time. You know, all of us has to gain experience somewhere. Okay, all of us has to gain confidence somewhere. Okay, if you want to be confident in orthodontics, you have to keep doing it until you feel like this is something you can do. Okay, so I like this. I came up with this, and I really think this is very, very true. Okay, confidence is through experience. Experience is through repetition. Okay, so you know, I could be here. I could, you know, they gave me an hour to do this. I would love to be here for longer than that. But at the risk of scaring everybody off, because when I start talking ortho, I'm just different. So let me see. Let me quickly show this real quick. Hang on, everybody. Give me 1 second before you guys go. Okay. Is there any questions that I can answer for you, or Yvette I can answer for you while I look up this case? Okay.
I was also going to mention that next month we are running a whole bunch of one-day intros, and some doctors, they like to attend it. They are going to be live and Zoom. So Yasin is going to post the link to the intros if anyone is interested, even if it's for the C units. And another thing I wanted to bring up is that if you are thinking, you can always visit, or you can take the first seminar and then kind of decide. But we have lots of, I think after taking the first seminar, it kind of becomes clear whether you would like to continue.
Yeah, and you know, COVID is here, I know, but COVID is like almost, well, I don't want to make light of it, okay? But we're all vaccinated, where most of us are, okay? Here in Washington State, we kind of treat COVID as a common flu now, which is kind of scary, but it is what it is. So, and we do offer both live and virtual class. I'm comfortable teaching either way. In fact, I think, you know, virtual learning has got its benefit. one of the benefits that I've seen is doctors now can ask a lot more questions in the chat, whereas they never would have asked questions in class sitting in the back, because sitting in class, you're just kind of afraid to ask questions. But in a virtual seminar, you can simply type in your question and the instructor will answer it, like I'm doing with you guys right now. Let's take a look at this case very quickly. I'll just show you the before and after. Okay. All right. I mean, look at this case. Look at how much gingival display there is to begin with. Look at the profile change. All right. So to me, these are, if this excites you, then I truly hope it does, because to me, when I see this slide, my heartbeat goes up, because look at the profile change. Look at the profile change. I mean, to me, this is a no-brainer. Would you want to do this? Would you want to provide this for your patients? Of course you would. To me, that's what we do in POS. Okay. All right. Any questions that I could answer for anybody? And guys, let me just give you my emails again, in case you didn't get it. It's blaoddds@hotmail.com. I guarantee you, if you ask me a question tonight, I will answer it in like half an hour. That's me. Okay.
My experience is that you answer within like few minutes. So.
Yeah, I know. Unless I'm sleeping. Unless I'm sleeping. Well, pre-COVID, I was always telling everybody, I will always answer your question within 24 hours, unless I'm sleeping or flying across continent. Okay. Those are the only 2 times I may not be able to answer you right away. But other than that, I will always answer your questions. Okay. All right. Hopefully this was somewhat informative. Hopefully this gave you guys an idea of what we do in POS. Okay. If you guys have questions, I would love to answer them. I'll stick around for a few minutes. You have my email. If you feel like you want to contact me privately, I'll be more than happy to answer your question. Just tell me that you came to the intro class so I know who you are and not give you a too complicated answer. Okay? All right. Any questions, anyone? Okay, and I would hope to see some of you sign up for our class, so we get to meet perhaps one day in person. Okay. All right. Any questions? Any questions? Okay. Oh, great. That's great. That's good to hear. Starting the course in May. That's great to hear. That is great to hear. Okay. Yeah, and guys, just this is from me personally to you. POS may not want to hear this, but this is how I truly feel. If you're going to do orthodontics, put in the hours and you're going to be very happy. Okay. I put so much hour into studying, analyzing cases after cases after cases. In the beginning, I probably put thousands of hours in there. Okay. Because this is not, because truth be told, you and I never learned how to do orthodontics in dental school. So the fact that you're reaching out to us and you wanted to learn orthodontics, my only advice, if I don't see you guys ever again, is wherever you decided to take on the course with us, because we have locations all over the world, my advice is for all of you to study. Okay, take lots of notes, ask lots of questions. Even if the questions are stupid, ask them anyway. Okay, because if you don't ask the questions, you're not going to learn. Some questions may be really, really simple, but if you don't know the answer, you don't ask, you're not going to know. So for those of you who does decide to join us, and I hope you all do, please study really hard. Okay, devote some time to orthodontics. because there's going to be a lot of information. And once you comprehend the information, to me, the entire world of orthodontics is yours now. Okay. And I truly feel that way because I went through the same thing. I'm a general dentist, just like most of you are. My practice is heavily devoted to ortho and implants, but I still do tons of crowns and bridges. I'm the same thing. I'll be 50 this year. My God, I can't believe that. Okay, I'll be 50 this year, but I'm still very excited about doing dentistry.
Yeah, you look so young.
I tried. Okay, I don't dye my hair either. Okay.
Wow, that's amazing.
All right. Any other questions, everybody? Okay. Yeah, and if you're located in the Seattle area, do shoot me up an email. I would love for us to get a class going here in Seattle, and I'd be happy to help put in your office and help you if you're close to me. Will you be mentoring for the upcoming Dallas and live seminars? You know, I will let Iveta figure out the schedules. Okay.
Yeah, you will be teaching the locations that will be opening this year in United States. You will be seeing Dr. Liao a lot.
Okay. So yeah, because Iveta is in charge, because we have tons and tons of very competent instructors. We have very good instructors down in Houston, Dallas area. No matter who you guys get, you're gonna love them. Okay, we're all trained the same way. It's not easy to become a POS instructor. We put you through the gauntlet. Okay, but once you're a POS instructor, all of us are more than qualified to teach. That's my true opinion on that. Okay. And we don't have a problem. Let's say, for example, if seminar 1 and 2, you had a different instructor, 3 and 4, you had different instructors. The continuity is always going to be there. So you don't have to feel like you have to stick with one person. Everybody is going to be on the same page. You're going to get consistent help. I do recommend that after you've gone through a few seminars, you pick 1 or 2 instructors and kind of follow them. Okay. All right. And pick an instructor you feel like that you're comfortable with, but you should not have a problem picking an instructor. All right. Okay. Dr. Hina, hopefully that answers your question. Okay. Any other questions I can answer from anybody else? There's still a ton of doctors that's still hanging on with us, so I appreciate that. I know it's dinner time. Guys, if you have questions, I'm here to ask. I mean, I'm here to answer. You know, I can, if you want to see more cases that, oh, you know what? I'll show you a case that I treated earlier, very early case. Okay. This is something I treated a long time ago. Yeah. Okay. This is a case I treated 20 years ago when I was in Arizona. Okay. All right. Very quickly, I'll just show you the before and after. Okay. All right. Okay. And I did this case when I was a student under the under the guidance of Dr. McGann. Okay. So, you know, it's something that you and I could do. It's not a problem. It's just whether or not you want to do it. Any opportunities in Massachusetts, Iveta? You want to answer that question for us?
At the moment, we are not planning, but we kind of we are always open to opportunities. If somebody we can do an internet assisted training class with 6 doctors or less. That's the IAT version. So if you have friends and they are interested in taking the seminar, then we can start at any location. For the live seminars, for the 48-day program, we need at least 10 or more students to start the class. But for the IAT, where the doctors start study online and live, we need 6 to open a class.
But Massachusetts is only a flight away from New York City, right?
Yes, and we are planning on New Jersey or New York.
Yeah.
That's
So
correct.
I would be, if I were, because, and guys, one of the benefits you have is you can travel the world and take POS classes globally, and it's all for free. So I say, for example, you want to go to a vacation in Bangkok, Thailand. You just let us know you're going to that class. That seminar is free for you, and you can pretty much write off the entire trip on your tax return. Isn't that wonderful? I think that's very wonderful. And Dr. Changwei, and I hope you do keep thinking about it. I'm just an email away. If you absolutely want to talk to me in person, I will even give you my phone number. Okay. Like I said, I'm here to help. So it's whatever you guys want. And again, it's once you decide to join, please put in the hours. Okay, because if you don't put in the hours and you don't study, then you're going to come away from it. You'll be like, oh, what did I actually do? What did I learn? It's important that you put in the hours so that you can learn about orthodontics. And it's never too late to learn. For some of the doctors are in this room that's been practicing over 20 years. It's never too late to incorporate orthodontics into your career. You're probably been successful for the last 20 years. You've probably got a few associates who's working for you. And you're probably getting bored with just the everyday clinical work. But now if you incorporate orthodontics in there, that's going to be a different ballgame, isn't it? Right?
I mean, I wanted to bring up, not to sound salesy, but really during the pandemics, we had so many doctors that came to us because they said minimal contact with the patient. So a lot of the doctors decided to take, some of them said, oh, I've been thinking about you guys for years and now is the time for me to.
Yeah.
And we offer like evening classes where the doctors only meet 30 times for 3 hours with self-study in between. So there is a lot of, even if someone takes the live classes, I would strongly encourage them to go online and study, because even if you are here for 48 days, we have so much more material online that we are just not able to show it in the class. So the resources are there.
Yeah. And, one of the major benefit of doing virtual seminars is, because there's difference in time zone. So while, like, for example, next week, I'm lecturing to a class in Malaysia. Okay, so the class will start at 5 p.m. going all the way to 1 a.m. in the morning. And that actually worked out for a lot of doctors in California. Iveta, like Veronica Gonzalez.
That's correct. Yes, I know she's there.
She's been attaching to my class every week.
I know.
Okay.
I know.
So that may work out for some of you, because you may be like, okay, I'm done with work during the day. When I go home, break out a bottle of red, start drinking while you listen to class. Okay. So that may work out for some of you, because with the virtual seminars now, because I find myself teaching a lot of late afternoon or late night classes, and it's opened a brand new door for me, because I see a lot of doctors actually logging on to attend my seminars from all over the world. So can I offer this to them, Yubeta? For the rest of you who are in class, next week, I am teaching a Malaysian class.
They can attend for one day free of charge.
You can come in for a few hours just to see how the classes run.
Yes.
Okay. If you want to, you're probably not going to understand everything. That's okay. All right. You can understand how the virtual seminars are being run, how I answer the questions in class. And that may give you guys an idea of how this is done. So for those of you who are interested in coming to my class, and it's going to start Wednesday around 5:00 p.m. Okay, please let Yvetta know. She'll give you the link.
Yes.
And she'll tell the coordinator in Malaysia to keep an eye out on you guys, so he doesn't kick you guys out for no reason. Okay, so that's an open invitation. It's free. So if you guys want to stop by, just say hi, kind of see how the classes run. More than happy to have you guys. Okay. All right. Any other questions? Any questions? Yeah, if you'd like to see the class, please email Yvetta or Yassine, and then they'll take care of you. Okay. All right. I can only do so much. Okay.
Yes, just please let me know, and I'll send you the
Yeah.
link.
Yeah.
And I'm from the coordinator.
Yeah, so that would be an open invitation to everybody in the class. If you want to just stop by for a few hours, get an understanding. Yeah, please, Dr. Deepika. Okay, I would love to see you. Just, just hop into class, just see a few hours. You're not going to understand most of it, and you may understand most of it. Okay, and that's okay, because like I said, we teach everything from the basics to the advanced. Okay. Ivetta's email. Yeah, Ivetta, do you mind doing that?
I'm going to put in my.
Okay. All right. Okay, and Ivetta is always there. She'll answer your email pretty much the same rate as I do. So we don't have a life, so it is what it is. Okay. All right. So guys, any questions that I may answer for the rest of you? Okay. All right. Dr. Cliff Chang, do you have a question? Anna Doe. Okay, Dr. Kavi. Okay, I'm kind of doing roll call. Dr. Mohammed. Dr. Jin. Dr. O. Any questions I can answer for anybody? All right. Okay. If not, then I guess we can close it. Okay. All right. Thank you, everybody. It's great to see everybody here. I wish all of your
Thank
camera
you.
was on. Okay, but it's okay. All right. Any questions? Anyone? Okay, if not, then I guess we will close it for the night. Okay. Thanks, Ivana.